about us. Think about you leaving.
Hello, hello, and we are live. Let's see where we're at. Let's see. Roel, what's up? So good to see you. Let's see if we're on Instagram. We are. Candace, what's up? B Baker, what's going on? I see you're an SLP. I love speech language pathology. It's amazing. Tom, what's up, brother? How are you? How's it going, man? I got a lift in today. It was a light lift, but a lift. Who do we got in here? I see we got Ryan on the ones and twos. What's up, Ryan? See, we got Jenny in the background. What's up? What's up? Stan, what's up? Great to see you. Candace, can you not hear me? Can you guys not hear me? Candace, can you hear me? Let's see if my sound is working. Is my sound working? Tom can hear me. Let's see if Instagram. Can somebody on the team check me out on Instagram to see if I'm working there? I don't know why that would happen. But let's see here. Hopefully that's working. Candace, am I back? Am I back on? I see Ryan's in there. Can you hear me, Ryan? Sweet. Thank you. Thank you, team. All right. I see we got Loretta here. What's going on? Let's see. Thank you. Thank you. We got a great show for you guys tonight. Doc is on his way. It might have been one of our best shows last week. We were talking about it later on during the week, and man, just everything about it was awesome. You guys did such a great job with amazing questions, and I thought Doc was awesome as always. So great to thank you, Candace. So as you guys know, if you guys have questions for Dr. Rogers, go ahead and put them in the comments. We had a few come in throughout the week, but only a couple. So we'll spend most of the time on live Q&A, which is at the heart of the show. As promised last week, we talked a little bit about this with Dr. Paige Mayo, talking about pelvic floor dysfunction. Super interesting episode. I encourage everybody to go listen to that. One thing about pelvic floor dysfunction is that people often think elderly or even with women post pregnancy. But man, it affects everybody. So everybody needs to watch it. It's super interesting. Just like that quote down there at the bottom, no leak is ever normal. We need to have these conversations, and I appreciate Paige getting on there and talking about pelvic floor dysfunction. Super interesting episode. And then on Explain This, the star of the show, Robin Riddle, talks about heavy metals. This is kind of a 101 and 201, which I think is really needed. A lot of the heavy metal talk can go a little above my head. So Robin was kind enough to kind of dumb it down for me and give us a little introduction to heavy metals. We're all exposed to them, and that episode is just about what to worry about, what not to worry about, what you're being exposed to, and maybe not realize it. So thank you to Robin for doing that. Such an important episode. I see D. Lynn's in here. What's going on? Great to see you, D. Lynn, as always. I want to put this up because we send out Performance Weekly on Tuesdays as well. And we put this video in, and I hadn't seen it in a while. I wanted to put it back in because, one, it was my last Botox treatment. And there's my brother right there. It's a demo with Botox, and I'm the guinea pig. And if anybody, there's like a couple of different reasons to watch that episode if you haven't. It's on YouTube. It's been there for maybe a year. But one reason is to just see me squinge a little bit. It's, it was my first time getting Botox. And the other reason is like, it's exactly what a Botox treatment is. Andy walks us through step by step, from, getting the needles together, talks about, where to decide to inject. He does such a great job with that. It was one of our favorite videos to do. So I hope you guys can check that out. All right. I see Doc is in the building. What's going on? I see everybody over on Instagram. Thank y'all for joining us there. Let's see. Is Doc ready to roll? What's going on, man?
Hey, Ben. Are you trying to look younger with the Botox? Is that what it is? Can you frown? Try to make some frowns in here. See if you can't do it, can you?
Well, you see that Botox treatment was a year ago.
Oh, yeah. I guess you need some more. You know what really make you look younger if you shaved your beard off and cut your hair.
I tell you,
a lot younger.
I do agree with that. When I shave my beard, I look significantly younger. And I might actually try that. I might try that plus a Botox treatment, and man, I'll be looking like I'm in my 20s again.
Yeah, the same for Christmas. Get some family photos this year.
I love it. How's your day?
Very good. Very good day. Enjoyed the Labor Day weekend, and just beautiful day today. Very busy. And,
I'm gonna let's see if I can find this. I know like we've been really pumped. We put this up in the weekly, so I'm gonna put it up again. We got the pain formula that just recently came out.
Finally got the pain formula.
Here's what's in it. One, because I know like if there is a question around like, hey, I'm kind of hurting, this will probably be mentioned. So take a look there.
Yeah, I like it.
We love it. How are you doing on it?
Yeah. I'm doing good. My back's way better. I feel good. I mean, I don't get sore as much as I used to. So I think it's a great formula. It's got a lot of great stuff in it.
What's your how much are you taking? You're taking, is it 3 daily or how much?
2 a day. 2 every day.
Mm-hmm. Just with one of your meals?
Mm-hmm.
All right. Well, I'm sure we'll get questions about it here shortly. I see Debbie. Debbie's back from the UK. Debbie's over in Australia now. My buddy actually was on a flight to Australia the past 18, 19 hours. He shot me a text while he was up in the air. But glad you're home safe, Debbie. Thanks for being here as always. It's Wednesday morning her time. Okay, we're gonna go to some questions here, guys. If you have a question for Doc, go ahead and put it in the comments, and we'll get rocking and rolling. You ready to start?
Yeah.
All right. I'm going to give a little background on this question. I didn't put the whole question in there, but it's about alternative treatments, and I'll kind of begin. It's basically around, the number one thing with a healthy lifestyle is nutrition. Shouldn't eat processed foods and prioritize protein and limit carbs. Water consumption is super important. Basically what it's getting at is there are these alternative things after, kind of those fundamentals. Obviously supplements is one for you. Nutrition being number one, exercise. The question is, what about some of the alternative things like essential oils, frequencies, grounding, lymphatic drainage, dry brushing, red light therapy, sauna, cold water plunges, and EFTs? And then the question goes, do you support any of these? How do you feel about plastics and microwaves? I guess the crux of it is, what is the most important to you kind of post, nutrition, exercise?
Yeah, I mean, those are obviously the best ones you can do, but yeah, I like all of them. I mean, they all work. You're just kind of taking it to the next level, really. I love red light therapy, lymphatic drainage. I love the cold water plunge. I get in my infrared sauna as often as I can. I really do love all the above mentioned therapies. You just take it to another level, which is a great thing to do, especially if you're, trying to detox, if you've been exposed to a lot of things. And Yeah, don't, microwaves not the best thing in the world, but it's a high level, of EMFs. Even a hair dryer puts out a high level of EMF, um, along with X-rays that you may have obtained. Um, so yeah, there's a lot of things that you can do. Grounding is a great thing to do. It's one of my favorites, along with the red light infrared saunas. And I love all of it. I mean, sometimes there's only so much you can do, but
Yeah.
I don't think anything takes a place of uh, eating the right kind of foods, exercising and sweating daily, getting a good night's sleep, keeping stress down. Um, I don't like plastics much, of course. There's just a lot of things I don't like. Aluminum. I don't like to have any aluminum foil in the house. And, you know, we do use the microwave occasionally. It's just kind of so convenient. So, but you have to, minimal use of these things is probably not going to hurt you. But if you're overdoing it, then you certainly could throw a monkey wrench into it, for sure. But I like all those therapies. They all work, in my opinion.
Yeah, it really is. It feels to me like, a balancing act. Don't feel like you have to do all of them. There's so many great things out there, and that's what I love about this show is, we get to, hear what's really working for the people who are with us live, and we get to talk about things that are working for us individually. But what I'm hearing from you is that they're all great. Um, if you can stay away from, plastics as much as you can, microwaves as much as you can. Um, as far as like a category, um, is there one that kind of stands out to you, in terms of like the alternative category after nutrition and supplements and exercise?
I like the red light infrared saunas. I think that'd give you the most bang for your buck. I
That's
have
interesting.
red lights in my sauna, of course, and I love it. You just feel so good when you get out. And, it's just, and then I jump in a cold shower. But I wish I had a cold plunge to do before I got into the infrared sauna. That's probably the best way to do it.
You know what?
Um,
I thought you might say that. So red light therapy and sauna
right.
would be
But
kind
they're
of in
all
that.
great.
Yeah.
They're all great.
Connie Lynn, what's going on? Great to see you. Thank you for joining us tonight. Great question. I love this. That was a great general question. I hope it helps more than a couple people. And it's a topic I'm sure we'll continue to talk about because might change here in a couple months. You might say I'm really into cold plunges now. Okay, let's keep moving. Is laser fat and skin removal effective? What is the limit on how much can be removed? The way I'm kind of taking this question is like, say you've, had some weight loss and maybe have some extra skin. What's your thoughts on this?
Yeah, I think it works. We have a couple of devices in our Johnson City office. We have a laser and an ultrasound um, fat reducing machines. Usually we use both of them. And skin removal, if you've lost a lot of weight and your skin is real lax, of course, it's pretty effective. It's a plastic surgical procedure, but certainly a lot of people get it. But remember, the laser and the ultrasound fat, they're for areas that you can't spot reduce. And so we do it a lot around the midsection, the back fat, behind your arms, that type of thing. And it really is effective at heating up painlessly and getting rid of fat permanently. It's not for weight loss, it's for really more reshaping.
Mm.
And it does tone your skin up as well. Skin removal is more going to be a surgical procedure. But how much is a limit? I don't really know. That's a real nebulous question. It's hard to say. You could overdo anything, but certainly if you go to a plastic surgeon, just take their direction on how much to remove and how often to do it. As far as the lasers and the ultrasounds that we use, it's usually a session of about 4 or 5 treatments, and then you may want to repeat it in another 6 months to a year. But it seems to be pretty effective for getting areas that otherwise you just cannot spot remove. It's certainly a lot less invasive, more affordable than getting liposuction. But liposuction is pretty quick. But that's a great question, though, because it's all body recontouring is what you're doing. But don't forget lifting weights and taking collagen and all this stuff too.
Yeah, it is as far as like kind of from an alternative standpoint, is collagen something that helps with that? Obviously,
Yeah.
Doing resistance training. I'm with you. Okay.
Yeah.
I see Carter's in here. Carter, happy Tuesday to you. Happy actual Tuesday to you. I hope you're having a wonderful day. Okay, let's keep moving here. This is one I think is close to home for you. Besides stretching, is there anything else that helps sciatica pain? Is that Ike?
Ike's wanting to come in early, isn't he? He's actually moving my chair.
Can Ike help us out with that question?
He probably could. He stretches out a lot. He does a down dog every morning. Perfect downward dog. Yeah, again, stretching is the number one thing you can do for sciatica. But if it becomes recurrent, you need to look at, you really need to look at your symmetry, because a lot of times, most of the time it's on one side, and that means you have a weakness on one side of your body. In other words, maybe you're right side dominant and you're overdoing everything on your right side. So I actually have to learn how to use your left side. And so you need to build up your left side and learn to stretch and relax your right side if that's where your sciatica is, if that's where you're dominant, like most right-handed people. But a lot of it's about symmetry, about, there may be areas of your body that are different heights. You may have a leg length discrepancy. You may be lifting things the wrong way. But, a lot of times with sciatica, if it gets really bad, I'll pop you a little dose pack of steroids for a short amount of time. You can always use non-steroidal anti-inflammatories. But sciatica takes a while to get better. If you tend to have a lot of chronic inflammation, and that's an inflamed sciatic nerve, I like the natural anti-inflammatories, of course. You knew this would come up. That's why I use the pain formula, which is 7 different natural anti-inflammatory medications or herbs, really, that are safe, and they really kind of work in combination to help any kind of inflammation. But some people say, well, you need to rest in the bed with it. I don't really like bed rest. I like people that stretch and are active. And a lot of physical therapists work on sciatica. But sometimes if it gets so bad, it needs a workup to determine, if you have what's going on in your lumbar spine. But in the way you're sitting, the way you're sleeping. And when you do stretch, learn how to breathe in, do that deep belly breathing in through your nose and out through your mouth. I think breathing with stretching is very important. And you never think about the way you breathe when you stretch. Most people, when they stretch, they hold their breath, when really they need to be deep breathing, that deep belly, diaphragmatic breathing. And you'll find yourself really learning how to relax into it. Just an amazing little trick is to learn how to breathe right. You breathe a lot of your pain away, I think. That really kind of activates that parasympathetic nervous system. that's responsible for relaxing. Maybe people are uptight.
And that's a
I hope
really
that helps. I hope
interesting.
that helps.
Yeah, that's a really interesting statement around like, you can breathe your pain away. I'm a big believer in, breathing well as also like nose breathing and, belly breathing, like you mentioned. That's super interesting. That is super interesting. And breathing through your stretching. Can you explain? I know I see my buddy Brandon's in here. I'm sure he doesn't know what a sciatica is. What is a sciatica? Like
Well, that's
what
just
is
an
it?
inflamed sciatic nerve, which runs. It's a
So it is
huge
a
nerve.
nerve.
It's a nerve, yeah, that runs down from your lumbar spine down the middle of your butt and all the way down your leg. It's a huge nerve. A lot of times when you have a deep butt pain, it's sciatica. Sometimes it's piriformis muscle inflamed,
Mm.
but a good doctor, physical therapist especially, can determine what you have. But it can be a really debilitating nerve pain down the back of your leg. That's what it is.
So
I
interesting.
know Brandon, he's probably predisposed to it. He's got real tight hamstrings. I've seen him stretch. He has tight hamstrings.
It is very safe to say he has very tight hamstrings.
Yeah.
I'm not sure I've ever seen him stretch.
He was known in college and high school for his tight hammies.
And in pickleball now, he hops right on the court. He just goes right into it.
I want to get him on the pickleball court. I'd really like to, I'd really like to play with him sometime.
We can. I'm sure we can make that happen. Okay, we're gonna get going, guys. We got live questions. I'm seeing them coming in. Thank you, D. Lynn. Thank you, Tom. Thank you, Loretta. Thank you, One Step Forward. We have live questions now. We're gonna go right into it. If anybody has a question, go ahead and put it in the comments. I see you, Amy. See you, Katie. Thank you. And we'll get rocking and rolling here.
I saw an 88-year-old man playing pickleball next to me yesterday, and he moved great. He hit great. He was 88 years old out there playing great pickleball. I hope that's me because that was something to see. It really was.
I love that. I love that. It's one of those sports where, you get to compete, but you're also moving and I'm sure a lot of brain stuff with
Great
hand-eye coordination.
Great for your brain.
Love it. I love it. Tom is asking an easy one to begin with. Did you get on the reversed hyper, Doc? I found out that a gym in your town, Apex Fitness, shout out to Apex Fitness, has one. Have you got one?
No, I've been considering it though. Which gym is? Oh, Apex. Okay, that's a well-known gym. Yep. I need to get down there and get on it. I will. Tom, I will get down there and do that.
I love it. Thank you, Tom, for that. We need to get Doc on a reversed hyper. Let's go to D. Lynn. Just wondering if Doc did any research. Yes, on rhinophyma for me. The cream is still not working. He goes to Dr. Thursday, was thinking requesting a dermatologist. Thoughts, please. We touched on this a tad. Do you remember we talked a little bit about rhinophyma? It's a type of rosacea?
Yes, it's a really bulbous nose. It's a problem with rosacea on your nose. A lot of people call it whiskey nose, but because people mistakenly thought people that had this were alcoholics. W.C. Fields was the most famous guy that obviously had a big bulbous red nose. But it's actually rosacea. So, you're probably using a Metrogel cream on it that may not be working. You may need to get some of the heavier hitters on that. But yeah, the dermatologist would be the one to go to. Sometimes it even requires surgery. I've never seen that done, but yeah, it's rosacea is what it is. A lot of people have it confused with alcoholism, but it's really not.
Is going to a dermatologist kind of the right move here? You're thinking?
Definitely, yeah. It's definitely who you ought to see.
D. Lynn, let me know in the comments if that's helpful. We can dive a bit deeper if we need to. Okay, let's keep going. Let's see. There we go. I'm seeing this just came up. I want to put this up from Well for everyone in here. The over-the-counter CGMs are available.
They are. They are. I told somebody to go to get it today.
Yeah.
It's made by Dexcom. It's OTC. It's about, I think it's $85, $90 maybe.
Is that what they are? It's for
yeah.
2 weeks?
Mhm.
Still 2 weeks?
10 days to 2 weeks, I think. Yeah. Yeah, I was pumped up about that too. I guess I told 2 people to get them today.
It's interesting because I don't know when they actually became OTC, and I knew it was going to happen. I don't know when it actually happened, but I have noticed a bunch of people with one on their triceps. You can tell they're OTC now, which is really cool.
Yeah, I'm gonna have Andy. Andy and I are going to do a podcast on that, I think.
Also, if there's people in here interested in doing a CGM, going to Publix or wherever you go to get OTC, Andy did a video with Doc on how to put one on. So that could be helpful for you guys. Kind of takes a little bit of the what would you call it? Just overwhelmingness of it.
Yeah, it's really easy. Does not hurt a bit, and it's very effective. This new Dexcom OTC is going to, I forget what they call it, but it's not going to have be able to show you very high numbers. I think anything over 250 is not going to show. But it's going to be good for most people, for that are type 2 or pre-diabetic, or people that just want to see what different kind of foods does to the sugar. Very helpful, amazingly helpful.
I like any of the tools that you can use to kind of figure out what works for you versus what works against you, because everyone's a tad bit different. There might be a food you eat that you think is healthy, but it's spiking your blood sugar up quite a bit.
Or even say like you have a problem with oxalates and you eat spinach, a health food, it may make you worse. So yeah, you're right. Very individualized.
All right, let's keep moving. Loretta, yes, actually it should be. Okay, I think Katie got you there. Thank you. It's going to be soon. Thank you, Katie, for that. Let's see where we're at. Let's go to one step.
Hey, let's do a test. Anybody that wants a pain formula, why don't we give them, if they're listening to this, some kind of big discount or something?
What can we do here?
They'd probably kill me for trying to interlude this, but I don't know.
No, I was talking to Katie earlier today. We were going to do a special yesterday for Labor Day, and honestly, I didn't think about it, and Katie didn't think about it either till late last night. So maybe we can kind of do something with that. We could do something with a 20% discount. It's going to be online. We'll wait till it gets online, which will be within the next week or so. You will get the discount code here. That's right, Katie. I'm gonna put this up because we got something up our sleeve. We'll come up with something cool for you guys.
I'm always one step ahead of Ben and Katie for sure. But,
okay, let's get to one step forward. Let's see here. I'm eating a low carb ketovore diet and staying away from oxalates as much as possible. Speaking of oxalates, is there anything natural I can do to lower inflammation for an upcoming Cleveland panel in October? Thank you.
Yeah.
That's interesting.
Yeah, great. Because I think you're on the right track with the low carb ketovore diet. Certainly no sugars. I talked to a guy today. He has rheumatoid arthritis, serum positive. He's on methotrexate for it. And he cut all the sugars out, was doing great. Then his daughter brought him some donuts, and he ate, before he knew it, he downed 2 donuts, and he hurt for 2 days in all his joints. I mean, he was hobbling around. That's how important diet is, and how important cutting sugar out of your diet is for a lot of people. But certainly, there's all kinds of things in that pain. That's why I created that pain vitamin. We worked on that for a year.
Yeah.
And if you look at the ingredients in there, again, you can look at, those are the ones that I think work the best. I don't know if anybody can flip that up again.
Oh, yeah, I
but
got it. Let me put this up here. I got it here. There we go.
Yeah, those are the ingredients I have, and I think the last one, the Paractin, the next to last one is kind of like the secret sauce on this one. But if you look at those ingredients, you also notice that your bromelain, your boswellia, I mean, they have a lot of other positives. So does turmeric. I mean, on a lot of other systems. I can't make claims about them, but if you do your own research and look at the other conditions that those herbals help. But that's what's in mind. Certainly, turmeric's probably the number one recognized, and you need the black pepper in there as well with it. It helps all of them be absorbed. But I think that's all of it's natural. It's not going to hurt you, and you get them all. One pill. I like the combination vitamins, as you know, because they work synergistically. You don't have to, guess and try a bunch of them. If one of them bothers you, I'd be very surprised.
And I'll mention one other thing that I've heard you talk about, and it's just top of mind for me because I'm in North Knoxville. I heard Margot and Andy talking about it. LDN, low dose naltrexone, is also really good for inflammation, or anybody
it's
who's
great for inflammation. That's a prescription medicine.
That's true.
I don't know if you call it natural, but it's certainly safe for most people. And look, if the other stuff's not working, look into LDN.
Yeah.
And of course, your diet's the main thing, but you're on the right track.
And I thank you one step forward. I hope that helps. Let us know in the comments if we need to dive a bit deeper there, especially with the Cleveland panel coming up. I love this from Amy, talking about the deep tissue massage. What about deep tissue massage or the heated rocks? I'll be honest, I've never done the heated rocks.
I have. They're great.
What's your thoughts on? I love deep tissue massage. What's your thoughts on these two for Amy?
Oh, I love it.
Yeah,
that's one thing I was going to mention. You said lymphatic drainage, which is a kind of a specialized form of deep tissue massage. But yeah, I mean, it's wonderful for you.
Yeah,
I mean, just amazingly good. And the heated rocks, I love the heated rocks. Those are more soothing. I really like the deep tissue myofascial release. If you talk to Carolyn Anderson and look at some of her work with it, it's pretty impressive.
It's so interesting. Thank you, Amy, for that question there. I'm a huge fan of deep tissue massage. I have not done the heated rocks, but you are saying that is a little more for relaxation, which is also very helpful.
I think it is. But yeah.
I love it. All right, we're going to keep moving here. Let's go to Susan. Thank you, Susan. I've been watching some of your shows. Thank you, Susan. Thanks for putting this information out there. I have been to performance medicine recently. I was there for some help for me, depression, no energy, hot flashes, etc. My husband is 64 and has Alzheimer's. He is currently functioning on about a 3-year-old level. Is he so advanced, and it's so hard to watch because he was always so smart and always took care of us? Susan, I'm so sorry to hear this. We've been to Johns Hopkins and the Pat Summit Foundation. My question, let's see if I can find it, Susan. Where are we at? Am I missing it, Susan? I'm not finding the continuation there, Susan. Can you put it in there, and we will get back to that?
Yeah, I'm sorry to hear about that. It's really tough. I saw my mom go through it, and really hard. One thing I'll tell you, you need to take care of yourself as well, because there's something called caretaker syndrome I saw happen with my dad, who was a physician, and he started getting dementia as well, because that's all he could think about was helping her and not paying attention to himself. And so that's really hard. There's a couple new approved drugs for it. I'm sure if you went to Hopkins, he's probably been on it. There are these very expensive, infusions. Aduhelm, I think, is the name of one of them.
Okay. Here's the question there, and this is what I'm sorry to interrupt you, but this is where you're going. Okay.
What help is out there for Alzheimer's? You can ask about the new infusions to see if that would help. There's been some improvement through the use of these things. About 1 out of 10 people have a brain bleed on them. So it's only 10%, but so they do routine CAT scans of your head. It is an infusion. They're very, very expensive, but I think they've been recently approved by Medicare.
Mm.
It's going to have to probably come through your neurologist. But I like methylene blue, certainly, if you haven't tried that. That's one of my favorite. I'll do anything. I'll even put them on Provigil, anything that will increase mental alertness would be helpful. Ketogenic diet, I'd be on that. I would not eat sugar of any kind. Physical therapy. You really got to, at his stage, you got to really try anything in the world that could help. Because it sounds like it's pretty progressive in a 63-year-old, 64-year-old guy that's functioning on that level. But we're always looking outside the box and things you can do for that. And there's going to be more of it out there.
Yeah.
You want to prevent the amyloid plaque and the tau from accumulating, and ideally that would be the treatment of choice. But a lot of times it's late in the stage, and you just have to modify everything else that goes on, and that's a toughie. But
Yeah.
look, ask your neurologist about Aduhelm, the new infusion for Alzheimer's, because it looks like it may be at that point. But certainly do try a ketogenic diet. There's other little things you can do, like choline, bacopa, omega-3s, that kind of thing that may help. But movement helps. But I want to be encouraging.
Well, I'm gonna put this up from Mark, because this is some things that might be helpful. Thank you, Mark, for this. Bromelain was observed to improve Alzheimer's fruit bromelain-derived peptides, destabilize growth of amyloidal fibrils. Thank you, Mark, for putting this in there.
That's in that pain formula too. That it has a lot of. I told you it has a lot of other positive benefits, and that's boswellia and bromelain are very potent. But read the book, The End of Alzheimer's.
Yeah, I was going to mention that.
By Dr. Bredesen out at UCLA. He has a lot of things. Look at all the hormone levels. It's been found that men that take Viagra have a lot less Alzheimer's. Dose dependent.
Yeah.
They also have found that people that use Ozempic have less Alzheimer's, dementia. I'd kind of be pulling out all the stops.
Yeah. Susan, I'm so sorry to hear this. I'm so thankful you're here and asked the question for your husband. I hope that helps just a little bit. And we're on top of this, and anything news out there, we'll study it up and talk about it here on the show. So thank you for being here. All right. I see Dave's in here. Dave, what's up, my brother? Great to see you as always. Thank you. Coal miner's daughter. I see you. Let's get to Stan. Stan is asking, when you have joint pain, how do you know if it is arthritis or gout? That's a great question.
It is a great question. Usually it's pretty easy though to look at it. Usually gout affects more the big toes than anything. If you have a swollen, hot, red big toe, you have gout. But it can also get in your knees and other hands, elbows. But usually it's really, terrible pain. It's a simple blood test you can get to deduce most of it. It's called a uric acid level. And that's something you ought to get a baseline on anyway, just to see where you're at. It's on every Cleveland panel. So if it's normal, pretty much probably don't have the typical type of gout. but usually gout's worse. It's acute. It's red. It's hot. It's inflamed. Even pulling the sheets up over your toes would really be painful. Arthritis is more of a stiffness and movement related pain. But great question. Great question. Get a uric acid level if you're any doubt and look at which joints it's affecting.
Stan, thank you so much for that question. Because I know that's helping more than just you. That's a really, really good question. Let's get to Patricia. Patricia, I believe this is your third week in a row, and I now think we're best friends, and I hope you feel the same way. Patricia asks, I take the majority of my supplements in the morning together with breakfast. I tried to list, but YouTube said it was too long. Wanted to know what supplements should not be taken together. That's a great question.
Yeah. I would probably not take magnesium with the others. I would take it at night. Some people say take zinc and copper separately, but I haven't found that to be a problem. I've checked levels because I take them together. They're both in my super vitamin. I usually like the B complex and the energy things to be taken in the morning. If for some reason you take EDTA, which is a natural chelator, which I take, just don't take that around any other vitamins within 2 hours on either side, because it can affect the uptake of your minerals. I'm trying to think of what else to tell you. There's not a lot of interactions. That's why I combine a lot of my vitamins. And I take them with food too. I've gotten in the habit of not eating breakfast and I feel way better. So besides the B complex and Digest Shield, I really don't need to take my vitamins till lunch and supper. So I split them up 3 different times. Well, 4 different times really. Morning, the water soluble ones, the lunch and supper, the fat soluble ones. And I take a lot too. And, that's one reason I combine a lot of these vitamins together. Like my energy formula has taurine, PQQ, and CoQ10 in it. You've seen what's in my pain formula. And I tend to take my longevity formula more at night when I have, because I've at least the apigenin in it helps me sleep. I take the baby aspirin at night, but because that's when I really want coverage at night. Most cardiac events take place early in the morning. It'd be interesting just to see your list and see, if there's any other contraindications to take them together. But probably not. I don't think you need to separate the fat soluble from the water soluble. You could still take them together. But that's a great question. Send Ben the list sometime, and I'll look at them.
Patricia, send me that list, ben@performancemedicine.net, and that way we can see what you're taking, and we'll shoot you an email back. That's awesome. Thank you, Patricia. Thank you for being here. Okay, let's keep going. Where are we at? Yes, I'm going to put this up from Roel. If you're going to buy a vitamin tonight, don't do it online yet, because there will be a discount coming. So if you guys can hold off just a little bit. We're going to do it for this crowd only online. So wait a couple of days. It'll be a great discount. Roel, you'll know about it. I know you follow us on multiple platforms, so you'll know about it, I promise. But hold off on getting them tonight if you're thinking about getting them tonight. Okay, let's see where we're at. I see Emily's in here. Thank you, Emily, for being with us as always. She's one of our estheticians in Johnson City. Let's see. I'm still looking for. Let's get this from Don. I love this question. I'll get to Edna. I see Edna. Do you take the pain formula daily?
Yes, I do.
And
It's
two of them
not.
did.
It's really, I think it works better. I take them together. Um, I take it with food, but um, the reason because I think they work better really for chronic pain, other than acute pain. I really haven't tested them much on acute pain, but it's more for chronic pain and stiffness. Um, but it's I'm gonna I've told some people to take it for a headache or just to see how it works or a sprain. But it's more formulated for people to take on a chronic daily basis to kind of tampen down the chronic inflammation that they have.
Mm. Thank you, Don, for that question. Let's get to another pain formula question. Can you take the pain formula with meloxicam?
You can, you sure can. Somebody asked me that today. Matter of fact, I told them sure. Not going to interfere.
Thank you.
The whole idea is maybe to get that to working so you don't have to take meloxicam.
Yeah.
Motrin, naproxen, those that can be kind of hazardous at times.
I'm gonna go to Instagram real quick as I saw this come up. Should I do a prolonged fast for 3 to 5 days? We probably need more context, but what's your general thoughts with a 3 to 5 day fast?
I've done a 3-day. I don't think I would do a 5-day fast. I would do a 3-day. Maybe every quarter if you want to. If you look at Dr. Atiya's comments on it, actually he was on there doing a 3-day fast with Chris Hemsley.
Yeah. Yep.
He was, and that's a great little series.
That is a great series. What's it called? Life
Outlive, maybe Outlive. Yeah. No, that's the name of his book, maybe. Just Google it. It's a great little documentary with the actor from Thor, and he goes through a lot of different things that challenges for longevity. And it's a really interesting documentary. In the end, he even kind of simulates his own death. He moves into a nursing home for a week. Dr. Atiya does. No, I guess it was Chris that did it. Hemsley, famous actor. He moved into a nursing home and wore glasses so that he could barely see. He wore things in his ears so he couldn't hear very well, and he had this aging suit on that not only made him look old but limited his joint mobility. I mean, he was creeping around and living at that nursing home with a bunch of nursing home patients, and to see what it was like. And then in the end, they kind of pulled him in this dark room and faked him having a cardiac arrest and simulated his own death. It's really an interesting documentary, but part of it was he went on a 3-day fast with Dr. Atiya and talking about the benefits. Since that time, Dr. Atiya is not big on a really prolonged fasting. As a matter of fact, that brings up Prolon, which is a dietary supplement that you can take. It's a 5-day little prepackaged thing that you can eat. It's mostly soups and broths and that type of thing, but a lot of people do it for to simulate fasting, and it works pretty effectively. It's not cheap. It's called the Prolon diet.
Yep.
But if you do it longer than 3 days, just make sure you're well hydrated, because you can really start getting into some electrolyte difficulties if you do it past 3 days. I don't think I quite made it 3 days. I came close, but it was amazing. I felt weak in the end, but I felt more mentally refreshed and mentally felt better. It clears up your brain, especially after the first 24 hours. You start thinking more clearly. That's amazing because your brain's running on ketones, not glucose. It's really interesting. Everybody's different, though. See, I don't know the purpose of it, besides maybe kind of more like a detox, which I think it's good. In your case, you may be doing it for a different reason, but there's a reason it's in the Bible, because it can be good for you.
And I think that there is some context. Big Papa of 6 on Instagram. I'm not seeing it. Can you put it in the comments on Instagram so I can see, and hopefully we can help you a little bit more. But I'm not seeing another comment. I apologize. Maybe it's
Maybe
oh, there we go.
For cancer,
there we go.
like that.
I see it. The question is, weeks ago I was lethargic and my wife checked my sugar. It was almost 400. I'm keto/carnivore since then, and I'm intermittent fasting. Okay. So what's your thoughts on that, Bob? Lethargic, check sugar is almost 400 now. Going keto, carnivore, and it seems they're considering doing a 3 to 5 day fast because it's around the concern with the sugar.
I mean, yeah, you're a diabetic if you're at 400, no questions asked. It's usually type 2. But, I've seen some type 1.5s. We had one in the office today, that adult type 1 required insulin. But,
and I'm seeing they haven't eaten and it's down to 130 now, and they're taking berberine.
Berberine would be my first choice for that. A very low carb, ketogenic type diet, carnivore. I'm all for it.
And down to 130, that's great.
That is good. Yeah. Just eventually you're not going to probably stay on a strict ketogenic. You may be able to, not many people can. But yeah, for type 2 diabetes, you should be able to cure that disease by what you eat. Type 1 you can't, but type 2 you can. Through the use of that. I mean, most doctors, if you went to the doctor, they put you straight on something for it. But just be careful. If you go more than 3 days, you need your electrolytes checked. Just do it where you have your doctor on board and somebody that knows about nutrition. You just don't want to get into problem. And please put a continuous glucose monitor on.
Yeah.
And see what it's doing at all times. Like we said.
I hope does that help? Is that helpful? Big Papa 6. Oh, cool. Thank you. Thank you for the question. Shout out to everybody over there on Instagram. Thank you guys so much. Let's keep moving. Where am I at? Thank you, Carter, for helping Kathy. Let's see, where am I? Let's get to Life with Lex. Life with Lex, what's going on? Any natural supplement recommendations for ADHD? I'm trying French Maritime Thyme Pine Bark and haven't noticed much. I've heard of others, but curious your thoughts. And I'm also going to put this up from Life with Lex. Also different, but very curious about parasitic cleanses. Never done one. Watch the video on the channel. Thank you. But it feels intimidating figuring out the optimal protocol. Great questions.
Yeah, you have to talk to Margot on that one as far as which protocol you should take. But yeah, it's a great thing. My favorite natural supplement for ADHD is L-tyrosine. And take it in the morning and sometimes combine with L-tryptophan at night. It's a good little combination. That's probably my most common one. Gosh, what else do we occasionally use? I'm always big on having a good fatty acid balance. Like omegas, I think, help for that. But yeah, the French Maritime Pine Bark, it's in the same category. But yeah, again, see how the natural stuff works. If it's really upsetting your life, we use a lot of prescription medications for it. I treat a lot of adult ADHD. The key to that and using a stimulant medication is to limit how much you use and to take breaks from it. But I've seen it work miracles. I mean, I had a lady today that it just changed her whole life. She said it was just a different ball game. She was taking Vyvanse. We put her on that, but yeah, it can be a game changer with a lot of people. But if it's just mild, you may try the L-tyrosine in the morning and L-tryptophan at night. Oh, I don't know why I didn't mention methylene blue.
I was gonna say it. I was gonna say it.
Gosh, I can't believe I almost forgot that.
And it
Yeah,
hasn't been mentioned. We've been going for 50 minutes, and
that'd be the
we have,
first one I would take. Yeah.
yeah,
Try methylene blue. It's
methylene
awesome.
blue. That's another one. Life with Lex. I hope that I hope you're still with us and are catching this. But those are I was wondering when you were going to say methylene blue. Thank you, Life with Lex. Thank you for being with us. Let's go to Freedom Forever. Ken, I'm 62 and doctor wants me on lisinopril and atorvastatin. What natural are
How did you
alternatives?
pronounce that? How did you pronounce that?
I need my methylene blue. I had mine at 11
Well,
a.m.
they
today.
misspell it. That's why you said it like that. It's really atorvastatin.
Atorvastatin.
There's
Okay.
no S in there.
I feel like
Yeah,
Freedom Forever
it's
did that to me.
Lipitor. You know,
Okay.
before Ozempic came out, it's the best-selling drug of all time. It's a statin drug. I'm not huge on statins unless you have some coronary artery disease. I don't like them. Lisinopril, I do not like. There's too many reactions to it. Again, ask your doctor if he's going to consider that to use two different medicines. One is losartan, which is just a better alternative than lisinopril. Way less chance for reaction, dry cough, 30%. An untoward allergenic reaction. I just never use lisinopril anymore. And if you have to, it depends on your risk factors and your lipid panel. Again, get either a Cleveland or Berkeley Heart panel. Look at your lipids in detail, particle size, etc., and ApoB status, and before you take those medicines. Again, I don't guess I'm supposed to be giving you medical advice on this, but all I'm here to do is educate and then talk to your doctor about it, because that's a knee-jerk reaction, and I just, number one, those aren't the two best choices. If I had to go on a statin, if I had risk factors and my cholesterol was horrible, and for plaque stabilization, I might use the low-dose rosuvastatin, which is Crestor. But I'd get a CT calcium scoring of your heart, and just look at all that before you dive into that. Again, you probably want to take a baby aspirin too. I definitely would. I do. But natural alternative, I like hawthorn a lot. That's probably my favorite. I like berberine. Berberine's great for both those, as well as some insulin resistance. I like omegas. I like to see what your triglycerides are doing. I like garlic tablets. So look at some of those. Probably the top one will be berberine for everything, because I bet you're a little bit insulin resistant as well. But get a CT calcium, see what your heart looks like, see if you got any plaque. Get on the baby aspirin every day. It looks like you're on bergamot is good. But I agree with you. And look at your diet. Look and make sure, and don't cut out your fats because your cholesterol may be a little high. Look at your insulin resistance numbers. That's what causes the inflammation, and that's the only reason a statin may work anyway. Can be a fairly decent anti-inflammatory for arteries, but I'm glad you mentioned that. I may give him the question of the night award for that one.
Freedom Forever, it goes to you. You got the question of the night so far. Thank you so much. I'm going to put this up from Life with Lex real quick so we can help her out. Is there an ideal break frequency? I'm assuming this is with the prescriptions.
I just say take it when you need it, when you have to work or go to school. When you need to focus, like on the weekends, don't take it. If you get a day off, and just don't work the dose up to, you're on prescriptions as well. Good.
Thank you, Life with Lex. I hope that helps a little bit. I want to make sure I get to Roel. I saw him up here. There we go. When I'm at home and check my blood pressure, I do nasal breath work and my numbers go down. Am I cheating? My numbers go significantly lower. So is Roel cheating here? I don't think
biohacking. He's biohacking. He's hacking, which I like. It's not cheating. Okay. I love it. Yeah. It's amazing what you can do with breathing, learning how to breathe right. And learning how to
Um,
relax, activating that parasympathetic nervous system. It's amazing. It's amazing too what exercise and a good night's sleep will do for you, and cutting out some of the stressful things in your life.
I'm gonna put this up for Michelle. I have seronegative rheumatoid arthritis, and I take LDN.
Good.
Thank you for
I
that.
bet it helps. I bet it
Yeah.
helps.
Thank you, Michelle. All right, let's see where we are. Real quick, for Life with Lex was talking about parasitic cleanses. I know. Have you watched the episode Life with Lex with Margot Kusturian and my brother Andy? They talk about parasite cleanses and this protocol. Now I'm blanking on it. The one that I think my brother might be right in the middle of one. But he'll be here. Come next week if you can, because I believe my brother will be doing the Q&A next week.
Yeah.
And he'll go deep on that. He'll go deep on that. Okay, let's see if we can, let's get Emily's up here, because I like this. We're kind of around the ADHD topic. Are there many misconceptions around ADHD? What's your, how would you answer this?
I would say, yeah, there's a lot of misconceptions around it.
Yeah.
And one, it's very common, and we seem to see it more nowadays when we have all these things that are bombarding us with messages through social media, through all the expectations people have, and they can't relax. And it's amazing that a stimulant would work to relax you. But one clue that you might have it is that if you drink coffee and it puts you to sleep rather than wakes you up, you probably have ADHD. But it's really common. It's usually a lifelong thing. There's a genetic tendency to it. So if your parents or brother have it, good chance you may have it. There's varying degrees of it, but there's a lot of misconceptions around the medicines we use for them too, like a stimulant like Adderall, Vyvanse, Focalin. They're class 2 drugs. They're very highly regulated, and you got to dot your I's and cross your T's, but they're very effective. They just, some people need them. In life, when you're being a doctor as long as I have, some people need Xanax. Some people need it because they can't function without. They're so hyped up and anxious all the time. Their life's miserable. So, and even though medicine like Xanax or benzos are habit forming in the hands of somebody that's experienced, along with the other type of psychological support, then it can be helpful. I don't like to give it, but I'm not going to turn somebody down just because it's Xanax. I'm going to use it, discriminately. But yeah, a ton of misconceptions about ADHD. You don't have to be hyperactive. You can have the type that's just lack of focus. But yeah, it's an interesting. I love treating ADHD patients. It's really interesting.
Emily, thank you for teeing us up with that. It's a great topic, one we need to, again, kind of talk more about. I feel like
it's not just the drug approach. It's there's other things you can do as far as organization and sleep, and it's amazing how these people with ADHD sleep better when they're on a stimulant.
I'm going to put this up for Life with Lex. Cellcore is what I was thinking of with the parasite cleanse.
Yeah.
And if you haven't watched that video, watch that one. There should be at least 2 to 3 videos on parasite cleanses.
Those look like Siamese twins on there. Don't they? The reason I mentioned that, we went to Mount Airy, North Carolina, over the weekend, home of Andy Griffith. Yeah. And right across from the Andy Griffith Museum was the Siamese Twins Museum.
Really?
Yeah, it was really interesting. Went in there and spent about an hour learning about these conjoined twins from Siam, which is what is now Thailand area. But really interesting thing about how these twins that came to America, settled. The reason it was there, that's where they ended up settling. They became entrepreneurs and plantation owners. This is back in the 1800s. They had a general store, and that they were from China. They had these Siamese twins, had a ton of kids themselves. They married sisters. And that's what reminded of when Carter and Katie were real close on that picture. They almost look like Siamese twins, which are really supposed to be called conjoined twins. But that's
right.
where the term came from, was these two Siamese twins. And that's the first ones that were really regularly noticed.
I love that. Thank you, Carter, for putting that in there.
What did Carter say? I missed it.
Just, I mean, favorite twins. Come on.
Yeah,
Come on.
your favorite. That's right. Definitely.
I love it.
Definitely.
Thank you, Carter. Let's get Debbie some help here, because Debbie just got off the plane. I know what she's going through right now. What's your thoughts? What's your thoughts with thank you, Matt. I see with jet lag for Debbie.
Yeah, hopefully you took some melatonin and slept on the plane. Just keep your regular schedule. Do not take a nap when you get off if it's during the day.
That's the key.
Stay up. Stay up. Do not go to sleep if you get to England in the morning or wherever you're going. Just act like it's a normal day. You're going to be tired, but then go to bed at your regular time, then get up. You'll be better in a day. Methylene blue helps, melatonin helps before bedtime. All those things can kind of, I think, help you.
Thank you, Debbie. Let's get to Mark's question here. I love this. Any thoughts on raisin water for hydration and as a mild laxative? That's interesting. Any thoughts here?
I don't know much about raisin water. I know there's a little trick you can do with white raisins. You can let them soak in gin for a week. Then you can eat about 10 of them a day, and it really is supposed to help arthritis pain. But I don't know much about raisin water for hydration. Don't know much about it. I know a lot about pickle juice from working with athletes on periods of time. As a mild laxative,
That's
raisins could
interesting.
be it's in the plum family. I can see that. But yeah, raisin water.
Thank you for that, Mark. Thank you, Bluebird Traveler, for that comment around jet lag. That's super helpful. Thank you so much. Matt, that's awesome. Thank you, Matt.
They are, yeah. That's a good one, Matt. They are conjoined.
Thank you, Matt, for that. Okay, I think we did it. I think we got. I want to put this up from Karen. This is a very kind comment. Seeing some improvement in A1C since starting the Dr. Rogers Berberine Max a few weeks ago. It's awesome. Keep us posted, Karen. Keep us posted with how you're doing. Thank you for the comment there. Robin, what's going on? Thank you so much for joining us tonight. I hope you're
Robin, hope you're doing well.
Yes,
doing
we're
great.
thinking about you. We're thinking about you. And we're certainly, I know you're going to have a real back in the office real soon. And I'm going to put this up for Robin here because Robin gave me the intro. There she is, intro to heavy metals. Check that out for Robin. Latest episode of Explain This. All right, I think we did it. Do we have any more questions? Have I missed any? If not, we're going to call it a show. Thank you, Debbie. Let's see. I think we're good. Thank you, Cherry. How'd we do? Pop, how'd I do, man?
Good. You did fantastic as always.
I thought you did
Really
great.
good.
I thought you did great. All right, we're going to call it a show. Andy will be here next week. We're going to be doing it Tuesday, 7 to 8, answering your health and wellness questions as always. Steve, I'm thinking about you, brother. Thank you so much.
Steve, I'm wearing this shirt. I'm wearing this shirt in honor of Steve tonight.
There you go. Look at that. Shield Nutraceuticals
I
right
hope he
there.
knows.
Digest Shield, Pure Chitosan 3000. Huge shout out to everything over there at Shield Nutraceuticals. Thank you, Carter. Thank you, Mark. Thank you, D. Lynn. Is that Ike?
That's Ike, but he won't come up now. So,
all right, we're going to call it a show. I love you, Pop. Thank you so
Love
much
you,
for
Ben.
doing this as always, man.
Good night.
All right, let's see where we're at. Outro, Brad, take us away.
Oh. don't go away.